Do you frequently feel like your heart is pounding, even when you're just sitting? Or maybe your joints pop out of place when you're just reaching for something. What if your skin tears easily from a small bump, but heals strangely? These might sound like separate problems, but for some people, they are all connected to a group of rare conditions called Ehlers-Danlos Syndromes, EDS. Think of your body like a house. The walls and frame need strong bricks and solid cement. In EDS, the cement, your connective tissues, which hold your body together, is weak or faulty. This affects skin, joints, blood vessels, and even organs. There are 13 types of EDS, all related to how your body builds collagen, a protein that's like the glue of your body. If that glue is weak, things start to move, stretch, or break more easily. So what causes this weak glue in your body? It's mostly in your genes, passed down from your parents, like eye color or curly hair. Imagine your DNA as a cookbook, and each recipe tells your body how to make collagen. In EDS, there's a typo in one of those recipes. Depending on which typo or gene mutation, you get a different type of EDS. For example, in the classical type, the typo is often in the COL5, A1 or COL5, A2 genes. In vascular EDS, it's usually the COL3A1 gene, which affects blood vessels and organs, making them fragile. Sometimes the mutation happens for the first time in you, even if your parents don't have it. It's like a surprise spelling mistake in your personal cookbook that no one else had. Let us play a quick yes or no game. Do your shoulders or kneecaps pop out easily when you are just stretching? Say yes, that is hypermobile joints. Is your skin so stretchy you can pull it a few inches and it snaps back like rubber? That is another clue. Do small cuts leave wide, paper-thin scars? Or do you bruise just from brushing against a chair? These are common signs. Some people feel constant joint or muscle pain, like their body is always aching without reason. Others might feel dizzy when standing up fast, like the room spins, because their blood pressure drops. In serious types, like vascular EDS, a sudden severe belly or chest pain could mean a blood vessel or organ is tearing. Scary, right? But knowing the signs helps you act fast. There's no single test for all types of EDS, so doctors play detective. They'll check your joints. Can you bend your thumb to touch your forearm? Can you put your palms flat on the floor without bending your knees? These are part of a scoring system called the Baton score. Then they look at your skin, scars, and family history. For some types, a blood test or skin biopsy, a tiny sample of skin, can find the gene error. Once diagnosed, treatment isn't about a cure, it's about care. Think of it like driving a delicate car. You need the right maintenance. Physical therapy helps strengthen muscles to support loose joints. Braces can stabilize wobbly knees or ankles. For heart issues, a cardiologist might monitor you regularly. Pain is managed safely, avoiding drugs that thin blood if you're at risk of bleeding. The goal, help you live as fully and safely as possible. Can we stop EDS before it starts? Not really, since it's genetic, you're born with it. But we can prevent complications. Think of it like weather alerts. If you know a storm is coming, you prepare. If you have EDS, you avoid high-impact sports like football or rock climbing, things that could dislocate joints or tear tissues. Use seatbelts, wear supportive shoes, and learn safe ways to move. For vascular EDS, doctors may advise against surgery or straining, like heavy lifting, to avoid ruptures. Genetic counseling is a big help for families, kind of like reading the forecast before planning a picnic. If you carry the gene, you can make informed choices about having children using tests like IVF with genetic screening. Scientists aren't just sitting back. They're working hard to understand EDS better. Recently, new gene editing tools like CRISPR are being studied to fix the faulty collagen recipes in labs, though it's not ready for humans yet. There's also a push for better registries, databases where patients share their stories and test results. Why? Because EDS is rare, and the more data, the faster we find patterns and treatments. Some clinical trials are testing drugs that may strengthen blood vessels in vascular EDS. Plus, patient-led groups are making waves, connecting people globally so no one feels alone. Imagine a world where a simple gene fix could help a child grow up without constant joint pain. That's the hope driving today's research.